Have you ever heard of penile cancer? Probably not something you think about often. And that's exactly the problem. Most people don't even know it exists, until it's too late. This isn't just some rare condition that only affects a few people. It's real. It's serious. And in many cases, it's preventable. So why don't we talk about it? Because it's uncomfortable. Because it makes people squirm. That needs to change, right now. If you're a man, if you love a man, if you care about your body or someone else's, this video could matter more than you think. And if you're tempted to click away, don't. Stick with me. What you're about to learn could literally save your life, or someone else's. In the next few minutes, we're going to break the silence around a type of cancer that hides in the shadows. We're going to uncover what causes penile cancer, not vague guesses, but real, evidence-based causes. And most importantly, how to lower the risks. No scare tactics. No shame. Just truth, straight up. Let's start with something most people overlook, hygiene. Not just basic cleanliness, but the kind of regular care that most men either were never taught or don't take seriously enough. Poor hygiene over time can lead to chronic irritation and inflammation, two major red flags when it comes to cancer risk. You wouldn't ignore a cut that won't heal, so why ignore persistent redness, pain, or a strange lesion? The body sends signals. But for some reason, when it's down there, people delay. That delay is deadly. Another critical factor. Human papillomavirus, or HPV. One of the most common infections on the planet. Most people don't even know they have it. And yes, it's directly linked to penile cancer. It's not just a woman's problem, not just about cervical cancer. This virus doesn't discriminate. It spreads silently and often without symptoms. The scary part. HPV can lie dormant for years. You could carry it and pass it on without knowing, and eventually it may trigger cell changes that lead to cancer. But here's the twist, there's a vaccine. A safe, proven, preventative measure that more men need to be aware of. The HPV vaccine isn't just for teenagers or women. It's a defense tool for anyone at risk, especially men who are sexually active. Still, because of outdated ideas and lack of awareness, many men never get it. That's got to change. And what about smoking? If you think it's only a risk for the lungs, think again. Tobacco messes with every system in your body, including the immune system. That means slower healing, higher inflammation, and more risk of abnormal cell growth, aka cancer. And yes, that includes penile cancer. Multiple studies have shown that smokers are at significantly higher risk. It's not just a statistic, it's a reality. Now, let's get real about circumcision. It's a hot topic, full of strong opinions. But let's strip it down to facts. Research shows that men who are circumcised, especially as infants, have a lower risk of developing penile cancer. Why? Partly because it reduces the chances of phimosis, a condition where the foreskin becomes tight and hard to retract. That can trap bacteria and lead to chronic inflammation. Again, it's not about judgment. It's about data. But none of this matters if people don't know the signs. Penile cancer doesn't scream in the beginning. It whispers. A small sore. A patch of skin that changes color. A wart that won't go away. Pain that seems minor. Most people ignore these early signs. By the time they realize something's wrong, the cancer has advanced. And that means harsher treatment, longer recovery, and worse outcomes. So, ask yourself, how often do you really check? How comfortable are you talking about what's normal and what's not? The truth is, many men avoid looking. They avoid talking. They let shame or embarrassment silence them. But ignoring your health doesn't protect it. Awareness does. We're not even close to done. There's more, much more, you need to know. And coming up, we're going deeper. How lifestyle choices, sexual habits, and misinformation create the perfect storm for this disease to grow silently. You'll see just how preventable this cancer really is. But only if you stay with me. Let's go deeper. We've already talked about hygiene, HPV, smoking, and circumcision. But those are just the surface. If you think penile cancer only happens because of one bad habit or poor luck, think again. It's not about one choice, it's about a chain of events, often built on misinformation, silence, and neglect. Let's talk about risky sexual behavior. Not in a judgmental way, this isn't about morality. It's about knowledge. Unprotected sex with multiple partners increases your exposure to HPV, plain and simple. Most people carry the virus at some point in their life. But the more partners you have, the higher the odds. The higher the odds, the more chances the virus has to cause damage. It's math, not opinion. And no, using condoms doesn't offer complete protection from HPV. That's another myth. It reduces the risk, but doesn't eliminate it. The virus spreads through skin-to-skin contact, not just fluids. So even with protection, there's still a chance. Again, this isn't to scare anyone, it's to inform. You can't make smart choices if no one ever gives you the full picture. Now let's talk about delay. Why do so many cases get diagnosed late? Why do men wait months, even years, after noticing symptoms? Simple, denial. Most guys are conditioned to tough it out. Ignore the pain. Assume it's nothing. Wait for it to go away. But that mindset is a trap. Cancer doesn't wait for you to be ready. It grows, silently, while you procrastinate. And then there's shame. Let's be honest, talking about problems in your private parts is still taboo for a lot of people. Whether it's discomfort, pride, fear of judgment, or just plain embarrassment, too many men avoid doctors until it's too late. But here's the truth, your doctor doesn't care about your ego. They care about catching disease before it spreads. That's their job. And they can't do it if you don't show up. So let me be blunt, if something looks off, get it checked. If it feels different, get it checked. If you don't know what's normal, ask. Because what starts as a small patch of rough skin can become a tumor. What starts as a small ulcer can become something much more dangerous. Early detection saves lives. Always. Now, how do you actually prevent penile cancer? First, start with awareness. Know what to look for. Know the risks. Know your own body. Second, take action. Get the HPV vaccine if you haven't already. Practice safer sex. Maintain good hygiene, especially under the foreskin if you're not circumcised. Quit smoking, if you do. And third, drop the shame. Your health is not something to hide from. One more thing that often gets overlooked, access to healthcare. In many parts of the world, men don't have easy access to doctors, or they simply don't trust the system. That leads to even longer delays in diagnosis and treatment. So if you're watching this and you have the ability to see a healthcare provider, use that access. Use it regularly. Don't wait for something to be wrong. And if you don't have access, then know this, prevention becomes even more important. You can't afford to ignore small signs. You can't afford to put off hygiene. You can't afford to believe myths or rumors over facts. Information becomes your most powerful tool. It's not enough to avoid disease. You have to outsmart it. Penile cancer doesn't care who you are, how much money you make, how many followers you have, or how tough you think you are. But it does take advantage of silence, ignorance, and delay. So let's break the silence. Let's talk. Let's share this video, not to scare, but to inform. Every view, every comment, every conversation can push this topic into the light where it belongs. Because if more men knew the facts, fewer would suffer in silence. We're heading into the final part of this video, where we'll break down what actually happens if penile cancer is diagnosed. What are the treatments like? What's the survival rate? What does recovery look like? And what can you expect if you or someone you love is facing this battle? Stay with me. What comes next is just as important as everything we've covered. If you've made it this far, you already understand one thing, this isn't just about statistics. This is about people, real people, facing a disease that's deadly, but often ignored. So now, let's talk about the reality of what happens when penile cancer is diagnosed. First, the good news, when caught early, penile cancer is treatable. In fact, survival rates are high, over 85% in early stages. But here's the catch, most men don't catch it early. They wait. They assume. They hope it goes away. And when they finally act, the cancer has progressed. So what does treatment look like? That depends on the stage. If it's caught early, doctors might remove just the tumor or a small section of skin. In some cases, laser surgery or topical medication is enough. Sounds simple, right? That's because it is, if it's early. But as the disease progresses, so does the intensity of treatment. In more advanced stages, doctors may need to remove part of the penis, or in some cases, all of it. That's not said to shock you. It's said to give you the full picture. Because the truth matters more than comfort. And for men who hear those words, we need to remove it, their world changes. Let's talk honestly about what that means. Surgery can save your life, but it can also impact body image, mental health, sexual function, and relationships. These aren't small side effects, they're major, life-altering challenges. And yet, many men who go through this say one thing: I wish I'd caught it sooner. That's the pattern. That's the lesson. That's why this video exists. Recovery varies. Physically, it can take weeks or months depending on the procedure. There may be reconstructive options. There may be therapy. There may be adjustments, big ones. Emotionally, it's a different story. Some men feel shame. Others feel grief. Some isolate. That's why support systems matter. Not just doctors and nurses, but friends, family, counselors. No one should face this alone. There's also the issue of stigma. Penile cancer doesn't get the visibility that other cancers do. You won't see charity walks or awareness ribbons on every street. That lack of visibility means lack of funding, lack of research, and lack of understanding. But that can change. And it starts with you. With us. With conversations like this. So, let's recap what we've covered. Penile cancer is rare, but real. It can be caused by HPV, poor hygiene, smoking, chronic inflammation, and other risk factors. Prevention is possible, through vaccines, lifestyle changes, and regular self-checks. Early signs are often small, painless, and easy to ignore, but catching them early changes everything. Treatment depends on the stage, but the earlier the better. Recovery is more than physical. It's emotional, mental, and social. Awareness can save lives, but only if we're willing to talk about it. If you've been silent about this topic until now, start speaking. Share this video. Comment below. Start the conversation with your friends, your sons, your partners, your doctors. The more we talk, the less power cancer has to sneak up on us. And if you're watching this and you've seen something strange, felt something unusual, or just have a gut feeling that something's off, listen to that instinct. Make the appointment. Ask the question. Your health is worth it. Your future is worth it. This video was never about fear. It was about facts. And power. And taking back control over a part of your body that most people are too uncomfortable to talk about. But now you know better. Now you're informed. And now it's up to you to act. Because silence doesn't protect you. But action might. Take care of yourself. Stay aware. Stay sharp. And thank you for staying until the end.